I'm Sean Vandiver with Community Live, and I'm here with Krista Waitt of Whitesboro Home Health out of Whitesboro, Texas. Krista, thank you for joining us today.
Thanks for having me.
Tell me a little bit about what y'all do. Obviously, home health is kind of a self-defining term, but what do y'all do, and who are your clients that you help?
Well, we have been in business for 20 years this year. Started out in Pilot Point in '92, combined our offices at the turn of the century, and we also have an office in Madill, Oklahoma. We do your basic home health. We accept mostly Medicare, private insurance, provide nursing, physical therapy, occupational therapy, speech therapy in the home. Sometimes people need help with bathing and personal care, some light housekeeping. We can also do that through Medicare or their insurance. We also have another department. It's called All Care, and they provide non-medical stuff in the home. If you need someone to stay with your mother or grandmother, even overnight or 24 hours a day, we can do that as well.
So it's a peace of mind type service for a son or a daughter to know that their parents being taken care of and watched after.
And that part isn't covered by Medicare insurance. There are some VA programs that we work with that allow coverage for that, but it's kind of a cash basis for the most part, and unless you have long-term care insurance.
Okay.
Some people are lucky enough to have taken that out before it was ridiculously expensive. And so that provides a way to offset the cost. So, you know, we try to just do the healthcare side of things, combine it with the other. You don't have to have both. You can just have one, short-term, long-term. We're there, end-of-life care. We're not hospice, but we do palliative care and try to be with patients to their end of their days if that's necessary.
Okay. Now you said Whitesboro and Pilot Point, y'all combined, is that correct?
Yes.
But you're located in Whitesboro.
Yes, our office is in Whitesboro. We serve a 50-mile radius of our office. We go all the way south to Denton.
Okay.
We go into Fannin County, right into the edge of Bonham if need be, all the way into Cook County. We do Lindsay, Gainesville, that area.
Okay.
In Oklahoma, we cover a 50-mile radius of the Marshall County Home Health Office, which is in downtown Madill.
So y'all have a very large area that you cover.
We basically cover 50 miles around Texoma, right? Sherman Denison, 50 miles around there. We cover that whole area.
Okay. If somebody wanted to get a hold of you, how would they do that?
They can call our Whitesboro office at 903-564-7709, or the Madill number is 580-795-9992, and either agency can answer questions about each one. We have the same owners, same family has owned us since the beginning.
So you're not a corporately owned home health organization?
We are not corporate.
Okay.
We are privately owned. We're a small agency. We service around 200 clients between both agencies right now.
But do you feel that allows y'all to give you a personal touch or a personal care for your patients or your clients?
We do. We like being the size we are. There's always room for growth, and we would never turn a client away. We can staff plenty of more clients, but we try to think that we're family oriented.
Okay. So you treat them like family?
We do. I've worked for the agency for 15 of the last 17 years.
Okay.
My boss and her sister are the owners. One's the administrator in Texas, the other's the administrator in Oklahoma.
Okay.
We have staff that have been there since the day the agency opened its doors.
So they have a very good retention rate.
Yes, we have a very good retention rate. We have some new nurses and new home health aides,
right,
and we contract with different therapists, and everyone we're just a real homey atmosphere.
Okay.
We bring our kids to work with us when they're sick or can't go to school, and we have babies at the office anytime, and we have patients we've taken care of off and on for 15 years as they've needed something or had surgery, and now that they're dealing with chronic conditions, you know, they call us and they consider us family. They consider their nurses and their aides their loved ones, and our nurses and aides, they get very attached.
Well,
they get very attached to their patients, which we think is a good thing.
Mm-hmm.
You know, we think it is.
Okay. What is your role within the organization?
Well, I started out, you know, in '95. I started out as a receptionist, just entry level. I was 19 years old. Through the years, I've done different things. Right now, I work in administration. I am our coding supervisor, and I try to handle staffing in conjunction with my director of nursing. And it's just been one of those things. I left for a couple years, went out to West Texas and ran a home health and hospice, but came back. I remarried in 2007. My boss called me and she said, "Do you want to come back to work?" And I was like, "No, I don't want to come back to work." But I went back part-time, and through the last 5 years,
kind of pulled you back in.
That kind of pulled me back in. I'm pretty much full-time now, but lucky to be able to have the flexibility I have. I'm a mom first and foremost, and our agency totally supports parents. We believe our family comes first. And that's another way I think it helps us with our families that we care for, because we agree that no matter what, your family comes first, and that's the priority. And so I'm just lucky to be there for 15 years. It makes me feel really old, but it's home to me.
That's great.
So.
If somebody has a question, but they're not sure if they need your services or not, is it okay for them to call and ask questions?
We have people that call all of the time, and I talk to most of those people. I just happen to be the one that talks the most, I think. That's pretty much it. I just talk a lot. And we'll answer any questions. Sometimes they need something that we can't meet their needs.
Right.
It could be that they have a very specific need, and it may not be something that our staff is trained in. We don't do pediatric care.
Okay.
We refer to pediatric home health agencies. Okay. Sometimes our staff may just be overwhelmed, and they may need something, and we're like, we work with other agencies, and we will refer them out. If we don't take their insurance, we'll take the time to call around, find an agency that's in network with their policy, because there's a cost when you're out of network. And Medicare Advantage plans. We take traditional Medicare, no questions asked. We don't have to get pre-cert or anything like that. Medicare Advantage plans are kind of tricky. Okay. Sometimes we can provide that care, and sometimes we can't, because they just won't allow us to, but we'll call the insurance company for the family and sit on hold so they don't have to, because they have a ton of things going on. A lot of times the people that are calling have kids, and they're calling about their parent or their grandparent. They can't sit on hold with an insurance company for 30, 45 minutes,
so y'all
2
can
hours.
help them with that.
We try to help them with that as best we can. And if it's something we can't provide for them, we just try to plug them in somewhere that they would have help.
Okay.
So, but they can ask any questions. People call and we never hear from them again. People call and say, I talked to you 6 months ago, and we're at the point that we need some help now.
Okay,
so
that's great.
We work with a lot of local doctors, wound care centers. The healthcare facility is huge. There's a million choices in home health.
Right.
We like to think, we're the best, of course, but we know that there's times we can't. We don't go far into Fannin County. So we'll call some agencies over there and say, hey, we have a patient that needs help. We have patients that move out of our service area, and we'll get their care transferred so they don't have to worry about moving to Houston.
Right.
We know a lot of agencies throughout the state of Texas because our owner is very active in the Texas Association for Home Care and Hospice.
Okay, so they stay up to date on all the law changes and everything that has to do with that.
Amy goes at least once a year to Washington, D.C. and lobbies for our industry. And there's a lot going on in the government that, our patients need to know about. We try to update them and say, you know what, if you want to keep your benefits, your home health benefits, your Medicare benefits, you need to call your congressman right now. And we provide them with that information. Regulations are forever changing. Obamacare has cut home health a lot. There's a lot of changes coming. We've survived all the cuts before. There have been major changes to home health and Medicare in the last 20 years. A lot of agencies have not survived those changes. We just try to stay on top of it. And if you know about it in advance, you're not shocked. So we know what's coming in 6 months. As soon as they notify us, we start preparing for changes in reimbursement, changes in the way they allow us to provide care, how we get paid. Different things change within, when 90% of your patients are Medicare, the government is, they're our boss basically. Right. So we just try to stay as up to date as we can, and we let Congress know when we think it's something that's not going to be beneficial to our patients, because that's who we're there for. So. Very
good. All right. Well, thank you for joining us today here at the Denison Main Street Fall Festival. Hope you can stay warm, and we wish you the best.
Thank you very much.